Hello, everyone, and welcome to today's webinar. Let's wait a few more minutes for participants to arrive. Hello to those who just joined us. We're just waiting for some other participants to join before we get started. All right, so I'm going to get started. Thank you all again for joining us today. Our webinar today will be on campus sexual assault responses, informing trauma-informed policies, protocols, and training. Before we get started with the presentation, I would like to review some housekeeping items. So I'm not sure what that's not showing too well, but if you're having some problems with your audio, please submit your, and if you're connected using a computer, submit, let us know if we could help you by submitting your question for any technical assistance. And again, I apologize, I'm not sure what the slide's not showing too well. Let me try again. But if you have any technical assistance, submit your message to us using the chat box feature on the bottom of your screen. If you have some issues with the audio, then send us, first try using the unmute and mute button on the bottom of your screen and see if that helps with the audio. And also try logging off and back on. Maybe that also resolves the problem, but otherwise let us know and we will be able to help you. If you have questions for the presenters or questions related to the presentation, submit your questions at any time during the presentation using your Q&A box on the bottom of your screen. The questions will be answered at the end of the presentation. And then just note that the recording and related slides will be posted in the next couple of weeks, so you'll have access to those as well. We would also like to acknowledge that this Brown Bag seminar is a team effort from the Rutgers School of Social Work, Violence Against Women Research Consortium, the University of Maryland School of Social Work, and the Office of Continuing Professional Education, and the National Institute of Justice. We are very thankful for this team and their support for this webinar. We would also want to note here our disclaimer that opinions or points of view expressed in this presentation are those of the presenters and do not necessarily represent the official position or policies of the U.S. Department of Justice. And now I am very pleased to present to you our moderator for today's event, Dr. Lila Wood. Dr. Wood is an associate professor at the Center for Violence Prevention, Department of Obstetrics and Gynecology at the University of Texas Medical Branch. Dr. Wood is a social work researcher with a PhD and BSW from Indiana University and a master's in social work from the University of Texas at Austin. Dr. Wood's program of research focuses on community and college campus-based interpersonal violence intervention and prevention approaches and the health impacts of interpersonal violence, specifically intimate partner violence and sexual assault. This includes assessing the impact of residential and non-residential advocacy services on the prevention of future violence and survivor well-being, evaluations of intimate partner violence housing, studies on the extent and impact of sexual assault, intimate partner violence, stalking, and sexual harassment on college campuses, and a statewide assessment of children's services in intimate partner violence agencies. Dr. Wood focuses her work across the lifespan with a focus on adults and children at risk for intimate partner violence and sexual assault. Welcome, Dr. Wood.
Thank you so much for having me this afternoon. I am thrilled to be here for this presentation about a topic that I'm so excited to hear more about. I would like to introduce our presenters for today. I'm going to start with Elizabeth A. Mumford, PhD, social epidemiologist and principal research scientist at NORC at the University of Chicago. Elizabeth conducts research regarding contextual explanations for risk behaviors with a central focus on sexual harassment, sexual assault, and interpersonal aggression. The current study focuses on the contextual environment of school-level policies and protocols regarding sexual assault prevention and response from the perspective of each school's health, wellness, and public safety teams. Very excited to hear more. Let me introduce our other two presenters. Josh Bronson is currently the Director of Education and Leadership Development for the International Association of Campus Law Enforcement Administrators, and develops and facilitates training programs on a variety of topics related to campus safety and the police. He has previously worked in campus policing and campus administration. Mr. Bronson is a subject matter expert in trauma-informed sexual assault investigations. I think we're having a brief PowerPoint issue that we're going to resolve, and I'll finish introducing our last presenter while we get that figured out. I want to introduce Kim Webb. Kim Webb is the director of the Relationship and Sexual Violence Prevention Center at Washington University in St. Louis. She has over 20 years experience working with individuals who have experienced trauma related to relationships and sexual violence. The past 16 years, Kim has worked specifically with the college population. In her current role, she is committed to raising awareness on the huge public health issues, promoting community engagement, and fostering a trauma-informed campus. On the national level, she serves on the board of directors for the American College Health Association as the immediate past president. Kim co-authored an ACHA toolkit for college campuses entitled Addressing Relationship and Sexual Violence, a Trauma-Informed Approach, as well as best practices for sensitive exams. In 2018, she was honored to receive the Ruth E. Boynton Award for Distinguished Service to ACHA, along with the authors of the aforementioned toolkit. So we have a wonderful panel here today. We're going to get started here in just a minute. as soon as we resolve our PowerPoint issues, but I'm really excited to turn it over to Dr. Mumford to give an introduction for the study and kind of set us up for today. I will just say a few housekeeping things. Please ask your questions in the Q&A box rather than the chat, and we will get to them at the end of the presentation. So again, please put your questions in the Q&A box instead of the chat. Dr. Mumford, over to you.
Thank you so much, Dr. Wood. And are we all set with the PowerPoint, or we can certainly present it from NORC if that's helpful?
It seems to be working now. Do let me know if there's some, it seems there's some lines that are not showing sometimes when I share. So if that happens, do let me know, please.
And we'll be prepared just to take it on then. Thank you. So thank you all very much for taking time out of your afternoon on a Monday in a beautiful spring to come together to talk about the Campus Sexual Assault Response Project, which we call the CSAR project. And thank you for the introductions, Layla. If we could now move to the next slide, please, Iris. So to dive right in, many of you or most of you are likely closely familiar with the issue of campus sexual assault, as well as with the policies and administrative protocols that guide how campus may be working to prevent assaults in the first place and to respond appropriately when a report is made. Today, we'd like to briefly review some background research that informed the CSAR study design, but the focus of the presentation will be on the CSAR project design itself and the first release of some of the preliminary CSAR results. We also want to talk to you about our team, our partnership with IACLEA and ACHA, and how we hope in our next steps to make this research useful beyond reporting the findings, which is where we hope you in the audience may also have some constructive comments and feedback on next steps. So if we could go to the next slide, please. And the next slide. So almost 25 years ago, Congress authorized a national study to investigate how institutions of higher education were responding to reports of sexual assault. This research, first published in 2002, drew on a content analysis of published sexual assault policy materials and state-level legislation, a campus administrator survey with responses from almost 2,500 campuses, and focus groups conducted with administrators from 8 institutions. This research was followed in 2015 by another nationally representative survey study that showed progress over the intervening 25 years. There were increases in schools with Title IX policies, as well as in sexual misconduct policies. And 3 out of 5 institutions of higher education reported primary prevention programs. Next slide. However, despite, well, you can, this is good. Oop. Let's see, I'll just keep talking because this is all fine as we get this back up. We know that despite clear policy progress, we know that campus sexual assault remains a critical issue for the safety and health of students and other members of college and university communities. And so in addition to tackling the issues from the perspectives of student experiences as informed by campus climate surveys, we wanted to shed some light on the administrative roles of key offices on campus, on their policies and training, and on the extent of collaboration between these relevant campus authorities. And I'll pause there for a moment. Would it be helpful, Iris, if we shared the survey, the presentation?
If you don't mind, yes. I think that there is an issue with compatibility issue.
Sure. So I think, Kate, if you could pull it up, please. And go to slide, what was slide 6, the project purpose. There you go. Thanks so much. So our focus for the CSAR study was on campus public safety agencies and health and wellness centers. We designed the study to collect feedback from a representative of each of these entities on the sampled campuses. Our purpose, simply put, was to inform improvements relevant to trauma-informed responses to campus sexual assault. Next slide, please. Thank you. Now, some of the research questions we have on the screen in front of you that we sought to answer, and these weren't all of them, but they're similar to the earlier studies I mentioned. We sought to measure current administrative policies, staffing, training, and collaboration relative to campus sexual assault. And as I mentioned, we designed the survey to gather information from more than one respondent per campus so that we could really look at that coordination and collaboration. So specifically, we talked to the public safety and health and wellness centers. As a nationally representative study, we were looking to see what variation there is in these key outcomes by campus characteristics. Today, we're also going to take a look at whether staff trainings cover major recommendations from the 2014 White House Task Force guidelines, and what we learned about the availability of safe kits and safe exams in campus communities. Finally, we will also share preliminary results distinguishing common profiles of campuses as defined by their required sexual misconduct trainings and participation in SARTs. I'm going to go into the study design more in a minute, but first I wanted to comment on how important it was to have experts in campus public safety and health and wellness working with us to design the survey instrument. We can go to the next slide, please. And this is where our key partnerships with IACLEA and ACHA came into play, as each worked really closely with NORC in designing the CSAR survey. So with that, I'd like to turn the presentation over here first to Josh and then to Kim to talk a little more about their organizations and the relevance to the CSAR project.
Thank you, Elizabeth. We at IACLEA, we're very happy and proud to partner with ACHA and NORC on this study. The study is of vital importance, and it'll help inform our work, which we'll talk more about later. A little bit about IACLEA for those of you that don't know who we are. We represent over 1,000 campuses worldwide, 7,700 memberships, and we're the leading authority for campus public safety. We advocate for both campus police, sworn officers, and non-sworn officers as well, campus public safety. We feel that all of them are sort of first responders. No matter whether they're sworn or non-sworn, they're going to be responding to all types of incidents, including those that are being discussed today. So we're really very happy to be part of this and looking forward to hearing the data and then using the data later on in our programs. So with that, I'll turn it back over to you, Elizabeth.
Thank you, Josh. Kim?
Thank you, Elizabeth. Hi, everyone. It's a pleasure to be here today. As Elizabeth said, I'm Kim Webb. I serve as the immediate past president of the American College Health Association. ACHA has really served as the voice of college health for over 100 years now, representing 8,000 college health and wellness professionals and serving more than 12 million college students. We have several relevant evidence-based resources that we really want to invite you to review today, and hope that they will be useful as you support optimal systems of care and accreditation processes. Among these are the Healthy Campus protocols, ACHA, PSAs, the Trauma Informed Toolkit, which I'm going to reference later. And our advocacy efforts at the local, state, and federal levels really have been priority around trauma-informed care and sexual violence over the past few years, particularly focusing on Title IX and the changes there. And so we're very interested in this work and very happy to be part of this. So thank you, Elizabeth.
Thank you, Kim. I will note that some of the people commented that it was a little bit hard to hear you. So when we come back to you in the latter half of the presentation, if you could lean forward. And Kate, if you could advance the next slide. We didn't share these while Josh and Kim were speaking, and that's my bad on advancing the slide directions, but this is in the presentation, which I believe is uploaded to the website, so you'll be able to see some of this content if you want to look at it later. And we'll go to the next slide, please. This is where we reviewed both IACLEA. Yeah. So now that we have been talking about our partnership and the key role that IACLEA and ACHA shared, if we go to the next slide. We show here a timeline. This was our advisory panel at the outset, where we had a number of experts who were recruited to work with us to develop the instrumentation, which we piloted with campus staff from health and wellness and public safety agencies to make sure we had constructive and valid measurements. And we want to make sure that each of these survey modules for the two relevant agencies on campus, health and wellness and public safety, captured information relevant to these practitioners, and that it would be ready for national survey implementation. But as a result of that design, it means that the wording of questions around a given topic may have been different between module 1 for the public safety respondents and module 2 for the health and wellness respondents. Or one of those modules may have had an additional follow-up question. It's not a great barrier, but we just wanted to let you know there are some differences. In other words, we didn't design this study to get validation of some singular set of facts from 2 administrative sources on each campus, but rather to capture their respective perspectives. Then moving into the field work, we drew a national sample of 1,500 institutes of higher education. That was step 3 on this timeline. And we're now in step 4, working to analyze the CSAR data. And pending results from these analyses and conditions permitting, we plan to conduct 5 campus case studies to assess the alignment of current practices with the campus's aspirational best practices, as well as real world contexts. Next slide, please. This slide illustrates the diversity of campuses participating in the CSAR study, in line with our sampling strategy to make sure we had representation of private and public campuses, 2 to 4 year institutions, and universities and colleges from across the spectrum of size. There are some limitations to our nationally representative sample despite oversampling. For example, we don't have strong representation from tribal institutions. We had 13 tribal institutions responding. We have to acknowledge that fielding the CSAR survey from October 2020 to August 2021 put us squarely in the middle of the COVID-19 pandemic. And school staff were stretched thin with many extraordinary responsibilities. As well, conditions on each campus varied greatly. So depending on the school, the month, and other factors, there may or may not have been residential housing for students, and classes may or may not have been held in person, and staffing may have changed over that period as well. All of this upheaval, it is possible, could have impacted responses to the CSAR survey. Next slide, please. But we forged ahead and fielded 3 survey modules for CSAR to each institution. Module 1 was sent to a representative of safety and security services on campus. Module 2 was sent to a representative of health and wellness services. And module 3 was sent to a central office campus administrator, often the Title IX office. So during the field period, recognizing that module 3 was not performing as well over time, we moved some critical survey items to modules 2 and 1 and closed down module 3 so that we could concentrate the efforts of our field staff with following up with representatives of public safety and health and wellness on each campus. In sum, we have responses to both module 1 and module 2 from 831 campuses. And you can see that we have slightly higher participation on module 1 and module 2 than that number, meaning there are some campuses that only responded to one of those modules. Next slide, please. Before we even begin to investigate policies and protocols, working with ACHA and IACLEA, it became clear that it would be helpful to understand the staffing structure on each campus. Note that schools could select more than one response. So these bars on the purple side for safety and security and the teal side for health and wellness, they don't add up to 100%. But looking at safety and security, we see that about 80% of campuses provide institutional public safety services or institutional police, sworn officers, including police officers. And these services are supplemented or replaced by contract security or external law enforcement on over 40% of campuses. As for health and wellness, most campuses provide health promotion services, and 4 out of 5 provide mental health services, whereas health care and victim services are less frequently provided on campus by the institution. So for some of our subsequent results, we had to roll up these staffing categories when we were asking about training or other aspects of their campus sexual assault relevant policies. This gives you some information about what staffing looks like on campuses. Go to the next slide, please. We're turning to some preliminary survey results. Next slide, please. Why training? The Campus SAVE Act and the White House Task Force Sexual Misconduct Checklist require prevention awareness and intervention training of students, faculty, and staff. So we know that implemented well, a prevention education approach can effectively contribute to reduce sexual violence on campus, as shown through some of Sarah DeGoo's work. Next slide, please. The CSAR survey modules, and this was confirmed by both the public safety respondent and the health and wellness respondent on each campus. These survey results provide encouraging information that 3 out of 4 campuses deliver sexual misconduct education programs to students. That's the data on the left. And then on the right, nearly 3 out of 4 schools provide trauma-informed education programs also to faculty and staff. What we see here, though, is that 1/4 of schools are not following through on sexual misconduct prevention programming. And that result is not evenly distributed across the sample. We found that larger 4-year institutions were more likely to report sexual misconduct education programs for students, raising concerns about consistent institutional investment in prevention on all campuses, regardless of campus size. Next slide. We also focused our questions about sexual misconduct training specifically on public safety and health and wellness staff on each campus. In some sense, it's encouraging that these results are similar to the prior slide, but we also need to consider that these staff may be on the front lines in responding to campus sexual assault. And we are still seeing that they are not universally trained to respond to sexual misconduct. Again, we found that 4-year institutions were more likely to provide this training. And particularly for the safety and security staff, training was more likely at larger public 4-year institutions. So we're getting into seeing what the profiles are of these policies and protocols. Next slide, please. Digging into the conduct of sexual misconduct training for these 2 staff categories, we do again largely see consistency from our separate campus respondents. But in reviewing the staff training recommendation from the White House Task Force Sexual Misconduct Policy Checklist, that's the first 7 rows of this table, we can see concerning deficits and topics covered during these trainings. For example, even the most common content, the Title IX guidelines and the sexual harassment policies, nearly 2 out of 5 campuses are not covering these topics. Next slide, please. And we'll move on now to start some task forces. Why are these important? To support coordination across different campus entities, the Office of Violence Against Women in the U.S. Department of Justice recommends that schools either participate in or establish a sexual assault response team, or SART, and a task force, sometimes called a coordinated community response team. We have some information on this slide that reviews how SARTs and task forces are designed to function, and our practitioners, we can talk about this more when we come back to the discussion later if there's some interest here. Next slide, please. What we want to show you is here the degree to which public safety staff and staff in the campus health and wellness center participate in a campus or regional SART. That's the first 2 data points on the left, or in a campus or a regional task force. That's the 3rd and 4th data points. Our analyses do show that once again, larger institutions, public institutions, 4-year institutions, these were all more likely to be following these White House recommendations. Understandably, schools with less resources or smaller schools may choose to work through a regional collaborative SART and task force to be able to draw on shared resources and protocols. But still, smaller private institutions were more likely to report no participation from either their public safety staff or their health and wellness staff. And 2-year institutions were more likely to report no participation from safety and security staff. So this is clearly an area in which campus safety and security and health and wellness staff can expand their participation and role in sexual misconduct prevention and response. Next slide, please, Kate. Moving on to safe kits. Campuses are recommended to make sure that community members are aware of where and when they can access health care options for treatment and to preserve evidence after instances of sexual assault. Next slide. In Module 1, safety and security staff were asked, and I'm looking at the left-hand side here, pie chart, are sexual assault forensic evidence kits, SAFE kits, made available to students who request them? More than 60% of campuses reported that SAFE kits are available to students either through campus health and wellness centers, that's the purple slice, through a non-campus partner, that's the teal slice, or both in that sliver of green. However, in Module 2, on the right-hand side of this slide, health and wellness staff were asked, when can students access sexual assault forensic exams if they request them? Over 3/4 of the health and wellness respondents indicated that SAFE exams were not available on campus. These data indicate first that there is a gap in communications between these two partner entities and what they know about campus protocols. And second, that there is a significant uncertainty about when and where students can access a SAFE exam. I'm sure this isn't true on all campuses. We'll get deeper into this data analyses, but there's still an area for improvement here. Next slide, please. So what we've shown you so far was some of the univariate and bivariate descriptive results. And we thought we'd share a sneak peek at a more complex model that looks at profiles of campuses in terms of their sexual misconduct training and education for faculty, staff, and students, and their participation, campus participation in SART or task force by the safety and security and health and wellness staff in particular. And what we found was that campuses cluster into 3 groups. And the good news is that nearly 2/3 of campuses report overall high levels of training, education, and SART and task force participation. And another 1/3 report high levels of training and education, but a low probability of SART and task force participation. These preliminary campus profiles are then fit in multivariable models, which we have not included in the presentation today, but to understand which campus characteristics will help define the campus profile. In other words, these analyses will eventually give us a picture of how these policies line up on a given campus and what other campus characteristics such as size, funding source, et cetera, tell us about profile classification. This is the kind of information that we hope can be helpful to those leaders responsible for funding campus programming, as well as leaders responsible for setting policy. Next slide, please, Kate. So at NORC, our next steps are to follow through on these preliminary analyses and to determine if we can identify profiles of best practice campuses to guide selection for case studies. Through these case studies, we'd like to examine the collaborative practices on campus and with local, municipal, and private entities in closer detail. So we're also turning now that the data collection is finished and our data set is clean to work more closely with our partners, IACLEA and ACHA, to incorporate and disseminate the CSAR results as appropriate through their organizational efforts. And I think we can go to the next slide, but I think it's best to hear about this directly from Josh and Kim. So I'll turn to Josh first to talk about IACLEA's plans and efforts.
Thank you, Elizabeth. And I just want to say how interesting I find the results every time you share bits and pieces of what you're finding, because I think it probably confirms a lot of what you all out there think or know, and I know it does for me as well. So what we're really excited about for IACLEA is how we're going to use this information then. One of the big pieces for us is training. We offer a trauma-informed response to sexual assault class, and it's very well received, but new data is always helpful. And one of the big pieces that we always push in that class is about collaboration. Collaboration with Title IX and student affairs, but also with advocates and health centers to better work together. So this will be really interesting to present to people to see if it sort of confirms what they're doing, what they're seeing on their campus, and then how they're going to use it then, particularly on their campus. So that's going to be one of the big ways that we use it is in our training programs. And some other things that we plan on doing, we'd like to have the data presented at our annual conference and you know, an article or two in our campus law enforcement journal. You know, we want to share the information certainly wide and far, but I think also using the data to identify additional partners like ACHA, but also outside of sort of the more typical groups that we work with, you know, NASPA and, you know, some of the others like that. But with like student-led groups, you know, and It's On Us or End Rape on Campus, you know, those types of groups that we may not have typically worked with in the past because they're sort of student-led, student-driven, almost activist groups. But I think that's going to be a really important piece where we can go to them and say, hey, look, here's the data, here are the problems that we're seeing in how things are connected and who knows what piece of information, and be able to take it to them too, so that they can help push for some of the changes that we want. None of the campus police and public safety or health, you know, health workers on campus, you know, want to not be able to provide that training to their staff, right? Some of the campuses that may not be able to do it or they can't do it because of funding issues and things like that. So this could really be useful in how we frame it to them and how we distribute it to them to really push for additional funding coming forward. So those are just some of the ways that we plan on using it. I'm sure that others will pop up, and we really do look forward to casting a wide net to, you know, really work with anybody, you know, regardless of whether it seems like there is a direct connection to the work that we do within IACLEA, but really to work with anybody, because we're all in this together. We all want to ideally put an end to sexual violence on campus. We know that's not, you know, really practical, but at the same time, you know, it's the goal, right? And so using data like this, working in coalitions and with partners, you know, I think that's really where we need to get to. So, and so I'll turn it over to Kim now, and Kim, you can jump in and.
We're not hearing you, Kim. Thank you. You probably tried to fix it from earlier and the fix went in the other direction.
Can you hear me now?
Yes.
Okay, my apologies. I wanted to make sure everybody could hear me. Thank you, Josh. And I want to echo a lot of the things that Josh said about how we work together and the opportunities we have to really tackle this problem. And I want to talk specifically about how we can utilize the CSAR data to create an infrastructure that really supports trauma-informed practices, policies, and protocols. And that's a really critical piece, right? I think it's really important to lay the foundation. And so the toolkit that ACHA created was really how to implement these policies and practices so that we can have that trauma-informed approach. And so I think the first phase is really identifying those stakeholders. And I love what Josh talked about just now is those stakeholders are many, right? And looking at those student groups and looking at other folks, who's your audience, and also who contributes to your response. And I think oftentimes of those folks on the ground that serve our students and know the student behavior best. And for us, I think of our faculty, I think of our food service workers, those folks who are in front of students most often, most frequently, and who can see changes. Additionally, who plays the roles of first responders and those providers, both on campus and off campus. I think as we think about the path forward, that really needs to be collective, right? It needs to be a collective effort. And I would say if we can go to the next slide on mine, I think when we think of that collective vision, we want to have a clear distribution of responsibilities among your stakeholders. And when distributing those responsibilities, consider who has social capital, right? And with what constituents do they have social capital? As you think of your proposal and your implementation of policies, practices, and protocols, That's an important piece. Engage in those deliberative efforts. Who are your stakeholders? Again, that social capital piece is important. Where do you start? Where do you have the most return on investment? And where can be most successful? So the toolkit is a place to start, and people will start in different places depending on the stakeholders they do have, the resources they do have. We talked about schools of different size and different resources and different engagement, right? Sometimes this is the beginning of a conversation for some folks, and some folks are further down the line, and we saw that in the data. It was very clear. And mostly we want people to be successful. So start where you can and where you have those investments. Make sure there's training resources and support to ensure success, right? So if we don't have ongoing training, if we don't have the resources to support, we're not going to be successful, and we're going to see folks who are not as engaged or willing to even try to implement these practices, policies, and protocols. Those collaborations are really critical, and those collaborations across your community, which involve people outside of your campus. Clear, appropriate, and consistent expectations for all partners. It's important for meaningful engagement. It's also important for the investment, both monetary and human resource wise, right? Like who has the time and who is going to put in the effort. And it's important so that people can recognize the benefits of the outcomes. And I think creating policies and procedures that ensure access and protections for all students. So really looking through that lens of inclusivity, of diversity. What are the barriers for folks? Who's missing in the conversation? And that's who's missing with their stakeholders, and what student voices are missing. And then once you pilot something or start something, always going back to it and reevaluating, right? So using that proactive, data-driven and those continuous efforts. So listening to students, listening to faculty, listening to your stakeholders, I think is a really critical piece. How do we listen, and how do we improve and continually change, and know that we may not get it right in the very first try, and it's evolving, right? That our needs evolve, the students' needs evolve, our stakeholders and the engagement and investment hopefully evolve. So really, again, continually evaluating the efforts and improving on those. And I will turn it back over to you, Elizabeth.
Thank you, Kim. Thank you, Josh. Layla, these are the ends of the slides that we have to share with our audience today, and we'd be happy to open up the floor.
Yes. So we have some great questions to start off, and this is a good point for people to add additional questions in the Q&A, please. This first question is, I think, probably going to go to Elizabeth, and it's about how something was defined in the data analysis. Could you talk a little bit about how ongoing education was defined? So the emphasis on ongoing. Is that just a one-time during freshman orientation, or is it repeated? And that's the first part of the question. So there's second part. Okay. But if you could talk about how you defined ongoing.
Sure, thank you. And I want to acknowledge that I have some great team members on the call here today who are very familiar with our data design, Megan O'Leary and Kate Spear. So when we measured ongoing prevention and awareness campaigns, that means that the programming's initiatives and strategies that are sustained over time and focus on increased understanding of topics relevant to and skills for addressing dating violence, domestic violence, sexual assault, and stalking, using a range of strategies with audiences throughout the institution. So that's from the SAVE Act and the guidance, but we don't have more detail in the actual survey instruments.
Okay, thank you so much. Somebody asked a question about, does the education profile, and I think you talked about this when you talked about the different kind of groupings that you had, does the educational or training profile look different for students who are commuters versus students who live on campus, or can you speak to that right now?
That's a really good question. And we know that the experiences of students who are commuters versus residential can be very different. It's also complicated because, of course, during the period of our data collection, the usual residential makeup of the student body was really cattywampus. We do have some data on what proportion of the students are residential versus commuters, but we haven't done those analyses, so I can't share those results today, but thank you for your question.
Yes, I mean, you have such rich data. I think this project's going to be the gift that keeps giving. Just staying with training, I'm going to move to a different person's question, but I'm going to stay with this idea of training. Do you have any information about the most predominant methods of training utilized by the institutions? So was it, again, new student orientation, webinars, any insight into what modalities or types of training are being offered?
No, I'm sorry, we did not document the modality of the training.
Okay. Okay, great. We have another question about the extent to which you might have any information from your quantitative or qualitative work about the role of local victim services or advocacy centers on and off campus in training and collaborations.
That's a really important part of our study design, that we wanted to understand what collaboration might be with the local entities, either public entities, municipal hospitals, or law enforcement, or private nonprofit organizations. We don't have that data to share today, but we recognize that for a lot of campuses, it's a natural partnership because of the need to use shared resources. Instead of having a health center on campus, there's a local health center that can cover these needs, and victim services. And perhaps, Kim, you may have further comment on the value of victim service agencies in localities, having it to be separate from the campus.
Sure. Yeah, I think that it's really important that we have relationships where we can, right? And we've realized that that's different for rural communities, but really important to lean on those. And a good example for us is, I know there's a lot of data collected around safe exams, and we really rely on our hospitals to do that because they're open 24/7 and our health center is not. And so it's a great collaboration with our local hospitals who fill that role for us and do a really good job in an area that we don't have the capacity to do that 24/7.
Thank you.
Sorry.
Oh, Josh, go ahead.
If I could just jump in too real quick. And I mean, this doesn't come from the survey data or anything like that, but anecdotally, and my experience, it's really important to involve and have those cross trainings. I know, for example, even when I was a deputy chief of a campus police department, we used to send all of our staff to the local rape crisis center, off-campus rape crisis center, to receive training on advocacy and how to be advocates. And so obviously that wasn't their role on campus, but now they understood the role of advocates. And so anytime there's training that can be done across sort of disciplines, whether it's on-campus partners or off-campus partners, it's really important to do that.
Another question about training I think could be good for any of the presenters, and maybe Josh, you could pick up on this one too, is somebody asked, are we kind of thinking that there's a positive correlation in training and number of sexual assault reports? Is that part of why we're looking at training so specifically?
I know from my perspective, so one of the other, I'll go back to another example from when I was a deputy chief. I really made a concerted effort to start training our officers in trauma-informed sexual assault response, rape culture, domestic violence dynamics, all of those types of things. And we also, at the same time, made a really concerted effort to do outreach to student groups. So we would start visiting student groups and talking to them about all the training we were doing and how we were responding. And we definitely saw an increase in the number of sexual assault reports. So I can't say specifically it was the training per se, or whether it was the outreach or just a combination of the two, but I would definitely venture a guess that the more training you're doing on the campus, whether that's for the public safety staff or the health center staff or faculty, the more you're talking about it, the more people are aware of it and the more likely they are to then seek out help, in my opinion.
I would echo everything that Josh just said, and we do a lot of training across campus and a lot of training with our community partners. We actually have a group called CSAR, University Sexual Assault Response Team, and we come together and do trainings together sometimes. But I think engaging students in that as well, so that everybody has the language. And I agree with you, Josh. I think there are probably several factors involved there, but there's a definite correlation between increased training and awareness and people having the language to talk about it and the safety to talk about it, right? We're not afraid to talk about it. We're not afraid to offer trainings about it. And so our numbers have gone up as well. But I think it's because we've made people more aware and we've increased access in that way. And people aren't afraid to talk about it in ways that they used to really shy away because they didn't feel like they had the knowledge or the comfort level to talk about it. And so I think that has really increased reporting.
Yeah, Kim, it sounds like you're talking about between Kim and Josh, what I'm hearing is, training might have the direct impact of letting a potential victim or support person knowing about services, but it also has this kind of more global impact on how people perceive the campus. I'm going to switch to a couple questions about the data that you have about safe kits or sane exams. There was a couple of good questions about that. One was about the extent to which your data is able to present information about the knowledge of safe kits versus the actual uptick of use of safe kits. So for example, the percentage of survivors you have on a campus versus how many are coming in for safe kits, and if you're able to collect any data around those metrics.
That's an important data point, of course, but that's the kind of information that's going to be more easily collected through campus climate surveys when we survey the student body and other community members so that we understand what the proportion of the affected population, what their awareness is. This is more from the administrative side where we're talking about what are the protocols, where is it available, when is it available? So it's a good question.
Keeping on kind of the safe kits, were you able to collect any information about the extent to which safe kits collected on campus, which seemed like a rarer situation, but the extent to which those kits are being able to be presented for testing at a lab, and it basically the untested rate or unreported rate of campus collected safe kits?
We don't have that data. Of course, it's a really concerning ratio, really problematic in a lot of communities, but we don't have that data.
I think, the final question about safe kits was talking a lot. It would seem like it was a very small percentage of campuses that were offering those. Did you notice any trends in what types of campuses are able to provide those services on campus?
I am going to comment here because my data analyst is online and paying close attention. I would say that my first guess is that it's the larger schools that have access to more resources that are providing these services with more consistency. And the smaller schools that either are turning to communities more likely or don't have the service availability and access at all. That's obviously not uniform, but we don't have the descriptive results yet to share today.
Thank you. There was an additional question that was kind of in the same spirit of that, which is, talking a little bit about significant differences in campus characteristics across the clusters in the latent class analysis. Is this pending further analysis, or is this something that you can comment on at this phase?
I mean, we're finding a very consistent story about public institutions really meeting the expectations of the White House Task Force guidelines, and larger institutions having those resources. So we expect to be able to release those findings soon.
Yeah, it seems to be a pretty clear theme. I was curious from any of your qualitative or survey work, if you had gotten insight. You had previously referenced resources and resource availability, but if you had learned anything about the particular barriers for the smaller campuses in terms of being able to meet some of these training or reporting related goals.
Yes, we did ask a couple of questions relevant to this. We asked about their budgets. We know about the campus student body size. It gives you some sense of what kind of budgets they're working with, but we also asked about resources dedicated to campus sexual assault response. And then because we were fielding the survey in the middle of COVID and before the vaccines were available, we asked a bunch of questions about what was happening on their campus and whether there had been any impact on their budgets for these services and any changes in their policies. So I don't have those analyses for you today, but we did want to take a look at what was getting in the way of providing these options.
Could you talk a little bit about, so many of us had projects that had ended up having this fielding date in the middle of COVID when practices were shifting drastically, right? Even if you don't have the analysis yet, could you talk a little bit about how you pivoted as an interdisciplinary research team during that time and how you maybe changed some of your measurement recruitment approach?
Well, this was a really interesting study to design. We haven't done one of these, a study just like this before. So we had a great time working with our very experienced field team because we were trying to get these multiple respondents per campus. So really it was as if we had 3 surveys going to each campus. Although we linked the studies, those modules, we linked them together so that individuals who got the survey link could refer to somebody else, connect with somebody else. And we had a field team of individuals who were very familiar with the higher education environment, who were able to call up and have conversations about who might be the best person to respond to the survey, what other support and questions they needed to answer. So because it was always designed as a web-based survey, that certainly was helpful given the conditions. But even so, as you all know, people were not at their usual desk answering their usual email account and that sort of thing. We really, we had to put in a lot more effort to reach this sample of about, well, over 900 campuses participating, which we feel very good about, given that that's what was contacted in 2015, and we were able to maintain that during the pandemic. But Josh and the team at ACHA worked so hard with us. We worked with other nonprofit organizations with membership directories, and we put out notices. You may not have been selected for this campus study, but if you were, or if you want to ask if you were, please reach out to us. We really ramped up our recruitment strategy to try to make sure that we didn't leave out any key sectors in higher education.
That's great. And it sounds like the field team was really critical to the success.
I wish they were on here today. 3 cheers for our field team. They really worked very hard, had a lot of very personal conversations with individuals out there who were wondering, what is this study? So yes, we really rely on our collaboration within our team.
We have a great question. I think it's a really important one. It's about trauma-informed intervention. So we often use the phrase trauma-informed. To what extent were you able to evaluate the extent to which trauma-informed interventions are being implemented on campus, whether it's training or support services? And how did you assess if it was trauma-informed? How did you define trauma-informed?
That is definitely one of the challenges of survey research, whether you put out a definition and ask everybody to rate their own experience and their own services relative to the definition we put out there, or whether you let survey respondents interpret the terminology themselves. And that is what we did. We asked them about trauma-informed training. We asked them a few other questions relative to their trauma-informed practices, and we let them define that themselves. Given that we did not have a universal response about all this trauma-informed training happening, even though in our world we tend to think that it's very prevalent and really common, the reality is that lots of campuses don't do that or didn't bring it up and it didn't resonate with them. So I feel relatively confident that those who are paying attention to that language have some knowledge and are making an effort in that direction.
I'd just like to ask Kim and Josh to chime in on this issue of how trauma-informed is defined in your particular respective spaces, and how you're kind of doing some of that work, especially thinking about disseminating the results of the study where we're talking about trauma-informed approaches. How are you discussing what makes something trauma-informed to your respective audiences? And maybe Josh could start us off.
Sure. So, we define trauma, for people, and, what that looks like as far as being trauma informed. We talk about that in our training material and, those sorts of things. I think it is really sort of a challenge though, because there's not sort of one standard out there of what trauma informed practices look like. I think Elizabeth, you were sort of talking about this too, but that becomes really challenging to say, well, we took a trauma informed class, well, what did that look like? What was the material? And very often it was not really trauma informed training. It was, they mentioned trauma or something like that, but they sort of consider it to be trauma informed training. So I think that's one of the real challenges out there. And I think one of the uses of the material, the study is that, we really do need to, as an industry, probably really hone in on, one definition that we can all sort of point to and say, this is what trauma informed training means. This is what it looks like. This is what it includes. That might be sort of wishful thinking on my part, but I think that probably at some point is where we need to go, where there is sort of one standard for what it means to be trauma informed in your training.
Yeah, I think that trauma informed has become a buzzword, and sometimes without really the knowledge base. And so what we try to do is really emphasize SAMHSA's principles for trauma-informed care, and that's what you'll see highlighted in the toolkit. And I think when we're talking to people and introducing the concept, we really rely on the four R's, right? Kind of realizing the widespread impact of trauma, recognizing the signs and symptoms, responding in a way that demonstrates your knowledge, and then resisting re-traumatization. But I think SAMHSA's outline, it really does give us a really nice framework for the work, and that's what we try to instill. I think sometimes people shy away from it because they have a hard time integrating the post-traumatic growth and the resilience piece. And so trauma-informed care doesn't mean hand-holding and some of the things that sometimes people think that it means. But again, we try to really integrate SAMHSA's principles for trauma-informed care.
Well, and to that point, for us in policing, in the police world, I know in particular, there are so many vendors out there, and I'm sure it's similar in other fields, but they all say that they use the best print. And I'm not discounting, what you just said, Kim, because that's fantastic. And, that's sort of what it should be, where you can use one set like that. I think from where I was coming from too, is that, we don't necessarily have that on the police public safety side, and we're very hesitant usually to use material that doesn't come from police and public safety. And so I think that's really where, material like this really points to, we need in policing and public safety, we really do need some sort of set, here's what it is, set standard. And that becomes very difficult because there are no national standards necessarily for police training across the country. There are recommendations and there's guidance and, all of these sorts of things, but there's no sort of, in order to receive national training credits, you can take this class. I mean, IATLIST has some, but it's not sort of widespread. It's not governed by a governmental body, that sort of thing. So.
Thank you so much, Josh. Kim, there's a request for you to go over the 4R acronyms one more time, if you don't mind. You're muted, Kim.
So sorry. Realize, recognize, respond, and resist re-traumatization are the 4 R's that we talk about. And I threw out the name SAMHSA as if I just assumed everybody knew, which was really unfair. Stands for Substance Abuse and Mental Health Services Administration. And they really are the forerunner in this work. But those are the 4 R's.
Thank you all so much. We have a few more minutes for a few more questions. I have a question I would love to ask, which is, and Elizabeth, you alluded to this earlier. One thing that's very exciting to me about these findings and these data is you're collecting data from administrators, health and wellness folks, campus security, not the team that we typically survey for a campus climate assessment. But if you could talk a little bit about how this study can accompany on an individual campus doing climate work, how some of the findings from this study might be able to support that climate work, and talk a little bit about the way that these findings can kind of integrate with our existing body of knowledge on campus climate.
Absolutely, and it is a perfect opportunity for a nexus of different data sources. You know, we'd really like to see whether it's possible to merge some of the reporting into the CSAR data set by institution at the institution level so that other analyses can be done. But this kind of measurement, if you do a campus climate survey, there are tools out there to measure the institutional structures and response as part of the campus climate survey. And now, having worked so closely with Josh and Kim's teams on these instruments, these can be used by campuses to try to bring together both student perspectives and some of these institutional structures to see what we're finding in terms of effective approaches to prevent campus sexual assault. But it's not enough to try to move the needle on student behavior without addressing the systemic structures, the collaboration, communication, the awareness of, you know, where can you get a safe kit? When can you get a safe kit? Was I part of that training? That was a 15-minute training, or that was a 3-day training? You know, that kind of information needs to be documented so that a campus can really look inwards and say, well, what is supportive of addressing this problem, and what might be some of the areas that we could work a little further on.
Thank you. I'm very excited about those possibilities in terms of this data set and some of our existing great campus climate data sets. So kind of a final question, I think it's a good one to end on. If funding is an issue to sustain training, what are possible ways to support, either through additional funding sources or other resources we might be able to use to implement more efficient trainings? So, you know, to that finding of a lot of where we're seeing some of the gaps on maybe the less resourced campuses, aside from going after very competitive federal grant RFPs, what are some of the other options for building sustainable evidence-based training?
I think Josh and Kim may have suggestions here, but the reality is it was possible before the pandemic, but the pandemic has really turned things on head, that people understand how much can be done remotely and what the opportunities are for training remotely. So if the requirements are there to get all your staff through this, maybe even to have discussion groups that go through the training together so they can talk on campus. Kim referred to all that collaboration you really want in your strategic plan. You really want to know which groups are talking to each other, who knows who's going to be doing what. So if those types of that content is raised in training that can be prepared and accessible free of charge remotely, and then the work is done on campus between these groups to really bring their heads together and make these choices to work together and with the local partners, that would, I think, not be as expensive as people might fear. But maybe Kim and Josh, if you'd like to comment.
Kim, do you want to jump in first?
Sure. I was just going to say that this is where collaboration is great too, right? That leaning on our partners, and people bring different pieces of puzzle to the table. And I think a lot of us in ACHA, and I'm sure IACLIA, a lot of folks have a lot of online training that is free and accessible. And so how do we pull those pieces and bring and do the best we can right now? And of course, funding is our ideal solution, right? Because I think we could do a lot with a lot of funding. And right now, as we get through what we need to get through, how do we lean on each other and really utilize, because there are some amazing experts in the field, and I feel so lucky to be part of this group, because I think I've learned so much from everybody here. And that's where we all pull together and share our expertise and create those multidisciplinary teams across. And as Elizabeth said, it's become far easier with our remote work statuses. And we've learned to be really adept at using virtual learning methods. So I will pass it to you, Josh.
Thanks, Kim. And I agree with everything Kim just said. I'll also add, from our where we sit, we've had campuses where, there are 10 campuses right in an immediate area, and they'll pool, money together to send all of their officers through training. For example, our training, where they'll hire, we'll come in and we'll train as many of them as we can. And we don't put a cap on how many we train, so that they can send as many people as they possibly can through that training. And it's very low cost then at that point. We're a nonprofit. We're not out to make any money off the trainings. We just need to recover our costs. So there are things like that. The other thing that I would say too, is if you're a police or public safety agency and you're out there, I would really seriously look at CRITAC funding. So CRITAC is a Collaborative Reform Initiative Technical Assistance Center. It's no cost. It's a COPS office program. There's no grant paperwork. It is, federal money, but there's no grant paperwork. All you need to do is be able to send an email with what you need, and it will cover sexual assault, domestic violence, dating violence, stalking, strangulation, all of these types of crimes. It will cover the cost of training for your agency. And you can invite in partners at that point too. The catch is that the request has to come from the police or public safety office. And yes, it is US based only. I see the question there. So I apologize for our friends north of the border, but it is US based. IACLEA's training is not. We could certainly do training in Canada. We have partners up there as well, to make it either virtual or lower cost. But and we also, like Kim mentioned, we do have some free training available through OVW, and you do not have to be within the US to take advantage of that. So we have some of that training available as well. So
Josh, would you mind just dropping that in the chat, that wonderful resource that I'm excited to learn about too? Elizabeth, I wonder if you could just end us up for today by, you all had indicated that some of these results are preliminary and that you're doing more analysis, and I definitely need to be seeing these briefs as they're coming out. Where can we look for data updates and briefs as they come out from this project?
Well, we will look to publish some of these data in peer review outlets so that we can get the benefit of that scientific review. But of course, we're going to work closely with NIJ and our project officer, Tina Crossland, because we want to make sure that this dissemination is as broadly available as possible. We'll work with IACLEA and ACHA. And as I mentioned, we work with a lot of other organizations during our survey field period. So we've really made a lot of organizational connections. And now, Layla, we know you directly, so we can be directly communicating with you to provide you with results.
Yay! See, this is why I moderate. I just want to thank Elizabeth, Kim, and Josh, and the whole field team, this amazing field team, for all of their work. This is so timely and important, especially with some of the really intensified efforts of college campus climate work in the next couple of years. So I'm just really excited about these findings. It seems like we've got contact information for folks, and there's more data coming, which is very exciting. Thank you all for your time this afternoon. Iris, is there any additional kind of closing that we need to do today?
No, that was all. If they're not, we're on time now. So I just want to thank everyone Again, I'm sorry for the technical issues, but it has been a great presentation and engage participants. So yeah, that's it. Thank you, everyone.